everyone, and welcome to my channel. We are healing. My name is Kara. I just want to give you a quick thanks for checking my channel out. If you haven't already, if you could like and subscribe, that would be great. I understand my videos aren't the most phenomenal yet, but they'll get there, I promise. I'm working on it. So if you could give me your support, it'll encourage me to want to continue. But on that note, if this is the first video you're seeing, I'll just give you a brief introduction again. This is my channel, We Are Healing, where we're going to talk about any kind of healing that anybody would like to talk about. But primarily, it's going to be a lot of the things that I deal with on a daily basis, how I handle them, techniques and stuff like that. I'm in trauma therapy. I deal with a lot of chronic pain and chronic illness. I have CPTSD and depression, ADHD, among other things, but that's kind of the gist of it. And so I just want to use this channel to kind of help other people who may be struggling with similar things, find ways to cope, ways to get through, maybe just to relate so that you don't feel so alone, and vice versa. I think that doing these channels is going to help me in my healing as well, because it keeps me focused on my healing. So this isn't just for other people, obviously, it's for myself as well, to help me with my learning and my growth, and then in turn be able to help you guys with your learning and your growth. Not saying I'm some wisdomatic guru that knows all, right? I'm not some prophet. That's not what I'm trying to say. But I think that when people post videos like this, talking about their problems, their healing, what they've done, things that they've tried, all that kind of things, those kind of things, it really helps other people as well. I am one of them. I've seen a lot of things through social media where people can explain things to me in ways that maybe I didn't understand before. And so it's helped me a lot in my growth and in my healing. And truthfully, a lot of things that I look up and stuff are on YouTube. Lately, I'm a little bit newer to surfing YouTube, although it's been around since I was a kid, and as a kid, YouTube was everything for us because it was like the first platform that you could watch videos like that. But anyway, it's a little different nowadays. But today I want to talk about what I'm dealing with today. So if you haven't noticed, I'm a little congested, so I apologize if some of the stuff is kind of like hard to understand, but I want to make sure I post a video every day if I can. And especially on these kind of days where I'm struggling, so that you guys can see what it looks like and see what I try to do to make things better, and maybe it can help you out. So one of the things that I want to talk about is stress and tension being held in your body, causing pain and problems. And for me, what that looks like is migraines. I've suffered with migraines since I was a child. And when I was a child, the earliest I can remember experiencing migraines is 4th grade, but that's because my memory is not great before then. So I remember specifically 4th grade when they got really, really bad, and when we started to try to manage them somehow. And so my mom took me to my regular doctor, and he suggested putting me on antidepressants and stuff like that after 4th grade. It was a while later. But before that, basically he thought that it had to do with tension and stuff like that. And he was totally right. But I was so young that I don't think medication was something they wanted to think about yet. So we tried those like menthol patches that you stick to the back of your neck, and it's supposed to like help with pain. That did not help at all. So fast forward to nowadays. About 3 to 4 years ago, probably. We'll say 2 to 4 years ago. My migraines got so severe that I couldn't function at all throughout life. I was starting to take like breakthrough medication, and like Imitrex I tried, and Ubrelvy, and I did not have good experiences with those. The first one I tried was Imitrex, and Imitrex was awful for me, but at first it worked. At first, it would at least alleviate the migraine to a point that I could function. but it would create this like tightness in my body and in my chest. It was mainly in my chest and in my throat. Like it almost felt as if my throat was swollen, like I was sick. And as time went on and I used it more often, it got worse to the point where I had to question whether I wanted to take the medicine for the migraine and deal with the side effects, or did I want to deal with just the migraine. It was bad. Um, and don't get me wrong, Emitrex might work for some people better than it does for me, but this is kind of how it works because I did a kind of a deep dive into it. What it does when you take Imitrex is it dilates it constricts your blood vessels so that you're not having as much of blood flow going to your brain. It's one of those things where they think that migraines can be related to too much blood flow. And so what it does is constrict your blood vessels. But it doesn't only target, what is up here. It targets other parts of your body. It targets the whole body, which is what causes that restriction feeling in your throat and in your chest. It got to the point where I couldn't use it anymore. And it wasn't even touching it. So then they tried Ubrelvy in addition to a monthly shot. Now, what led up to that was it got so bad that no matter what I did, it caused a migraine. My ex had a boat, so that's an example. We'd go out on the boat, and as soon as we'd hit a wave, I had a migraine. If I rode my motorcycle, migraine, which that's understandable because your tension, you're like this most of the time. I have a rocket, so you're leaned forward most of the time, so it makes sense. And you're using your arm strength mostly, which is going to cause a lot more stress and tension on your shoulders. Makes sense. Other things, say someone like tapped my head, migraine. Jumping, migraine. Head upside down, migraine. It was literally running my life 100%, and I couldn't take it anymore. So I had gone to my neurologist for a follow-up appointment, and I was in tears. I went to her and I said, listen, I can't live like this anymore. It's running my life. I don't understand what's going on. And so they decided to do a CT because it sounded like my migraines were caused positionally, meaning if I laid in a certain position, I would get a headache. If I went on the boat, that's called kind of a positional migraine because it's being caused by something happening. So that was concerning for her because that can mean that there's some kind of pressure being pushed by maybe a tumor or something like that. Did not come back with anything like that. Apparently my brain looks perfect. So that was awesome to hear. But she highly, highly, highly suggested that I finally try a breakthrough medication. Now I'm sure you're wondering why I didn't do that sooner. And the reason is because I did not want any more medications. I was sick of trying to figure out for my whole life what was the problem causing my migraines and trying all these new medications to try to take care of it. I was sick of it, and I was sick of the stress of not figuring it out, and I felt hopeless and I gave up for a while until it literally ran my life. Deciding to start the preventative medication for migraines was the best decision I had made. I went from having a majority of migraine days every month to having maybe one a month. And that one came around the time of my period. So that makes sense. Hormone changes cause that. So it is much more manageable now. But the shot is awful. It's a shot, once a month injection. You have to actually qualify to even get this medication, and that's by failed attempts with medications that didn't work for me. So I qualified. I was well overqualified for it. And so for the first month, you take 2, and then after that, it's once a month, and you do it yourself. I'm actually going to go get it just to show you what it looks like. Give me 1 second. So this is what it looks like. It comes in a box like this, and it has to be refrigerated. It's called Emgality. And I was a little behind on it. I'll explain that in a minute, but I was a little behind on it, so I have some extras, but I'm not going to actually do the injection right now. I also don't know if I can even do that on YouTube. I do have a video of me doing an injection for myself for the first time in a very, very long time, that maybe I can upload later, but it didn't upload to TikTok because I think because it was a shot. So I don't know if I can even upload it here. But I'll show you what it looks like. This is what it looks like. It looks like a little pen. And what you got is, here's your lock and unlock button. So what you're gonna, and then here is where the needle is. What you do is you take this little cap off. The needle is not exposed. It does not get exposed until you hit the button. And you probably can't even see it in here in the video. You can kind of see it in there. It's very small. What you do is you take this cap off. You unlock it. You find the spot you want to inject. You press the button and hold it. You don't have to hold the button, I'm sorry. You press the button and it's going to inject. And when it's done, it'll click again, and that's how you know you're done. I haven't timed how long it takes. It's probably like 5 to 10 seconds. The initial injection, like the initial needle part, does not hurt. What hurts is the medication going in. So for the first month when I did this for myself, I stood up in my living room and I tried to do it myself. And they say that you should do it in your leg. I've also heard that you can do it in your stomach. Sorry, I got distracted. My son needed help. He's making himself chicken nuggets. Oh my goodness, I couldn't even get the words out. But anyway, so the first time I did this, it was 2 doses. And they recommend that you put it in your thigh or your stomach. I heard that you can do your stomach. I thought you couldn't, but I got clarification from my doctor that you can in fact do it in your stomach. But I think she said that it's not necessarily the best place, especially since I don't have much fat on my stomach. What you want to do is find a fatty spot. You don't want to go directly into the muscle. That will hurt. If you're like me and you don't have very much fat, it's hard to find a good spot. The best spot that I have found is, and it's in the video that I did last. When you sit with your knee bent, my pants, I can't show you great, but when you sit with your knee bent, you know that little fatty spot right here? That's where I did it last time, and that one wasn't so bad. Oops. Previously, I would do it right on the back side of my leg, right under where your butt cheek and your thigh connect, because I figured that's probably a fatty spot. I don't think that was the best idea either. I've tried a few different spots on my leg, closer to my knee, further back, mid leg. I can't really say which was the best, because it seems that even if I were to do it in the same spot, sometimes it hurts worse than other times. So it may just depend on how my body is at that moment in time and how my immune system is reacting, how my body feels, like how my nervous system probably is. But the first time I did it, I stood up in the living room and I tried it right in my thigh. And I put it on my leg, I clicked the button, and I was holding it, and it started to burn, like, really badly. And I was trying so hard to not let my reflexes just toss it across the room, and then it went flying. The burn is bad, and it gets worse as it's going in. So after I did that one, I ended up having my ex do it for me every time. He did it great. If you can have somebody else do it for you, that is awesome. But from personal experience, I will say, if you're not in the most stable relationship, I would not rely on someone else doing it for you unless you have a friend or something like that. Somebody that you know is not going to, like, randomly disappear from your life, because that happened with me. I was with him for 3 years. And when we broke up, I couldn't do it by myself. missed months because I was so terrified to do it. Especially for the fact that if I tried and I threw it across the room, then I lost it because it doesn't stop injecting. So as soon as that button clicks, like, you have to get it all into your body or you're screwed. So when I tossed it across the room, it was just pouring the medicine out. You can't stop it. Once you click that button, it just keeps going until it's done. So my ex did a really good job at it. I would lay on my stomach and he would do it in that spot right under my butt. And he would hold my legs down because I'm telling you, it's so bad for me that, and I think it's pretty collectively bad for most people, that you will jump. And so you don't want to kick that needle out as it's going in. So what he would do is kind of like hold my legs down. He would pinch my opposite leg to kind of distract me, and then he would do it. He did it great. Sometimes it hardly hurt, and sometimes it hurts really bad. Majority of the time, it hurts pretty bad. But now that I scared you away from it, let me explain why it's not something to be afraid of. I have maybe one migraine a month. That's all I need to say. This one time a month pain is so much better than having a majority days of the month be migraine days. I'm grateful for this. I really am. I'm very grateful for this. The other thing is that they recommend that you keep it out of the refrigerator for a little bit before you inject it because it should hurt less when it's not as cold. And then they also recommend that maybe you ice the spot before you inject it. I don't know if that really helps a whole lot. I will find out soon because now I'm having to inject it myself. Last month was the first time in a very long time that I've had to do it myself. So, like I said, I do have a video of me doing that. If I can post it, I will, because I think it does help with people who have to do this now, especially if you're somebody who has to do this without help. But along with the migraines, like I said, most of it's tension. When we have stress and tension, we hold it somewhere in our body. Some of us clench our jaw. Some of us have really tight shoulders. Um, I'm sure it can happen in many ways. Some of us maybe clench our fists, stuff like that. So, and a lot of times this is something we do subconsciously. We don't even realize we're doing it, which is why I didn't realize that I was causing myself migraines by allowing myself all this stress here. Now what I do is a lot of techniques to try to relieve stress and to also try to like build up strength up here, because building up strength up here will be very helpful in dealing with tension, at least I think. Don't hold me to that. I don't know for a fact, but I'm guessing. Um, but today I'm dealing with something a little different than the migraines. And if you would like a video more about migraines, let me know. I can totally dedicate a video to migraines, how they work, how they feel, how to manage, techniques, things like that. But today I kind of wanted to start to make a video about how I deal with the chronic pain I deal with. I get a lot of tension, as I just said, in my shoulders. And so I get a lot of it in my shoulder blade area. And for the last 2 days, I want to say, this side has been absolutely horrible. And so I have a few techniques that I use to try to relieve that when I get a tight spot. A little backstory real quick. My ex was a massage therapist and he worked with Trigger Point. He was also Reiki certified, and he also used to do like assisted stretch. He does post-operative massage, stuff like that. He is the only person I have ever met that can give me a massage that actually gives me relief. And it's because what I've realized is what I need is Trigger Point. So I have a lot of understanding and knowledge when it comes to muscle tension and how to relieve it because he's taught me a lot throughout the process. But I'm not some expert, but I'll share what I know. So one of the tools I use is my hook. I love this thing. There are many different variations of this. I would like to try some more variations at some point, but I cannot live without this thing. And the reason is because you cannot get to that spot on your shoulder blade on your own without something like this. So I bought this so that I could try to relieve that in my shoulders on my own. I didn't have anybody who could help me with it. I was trying to feel better. Yesterday, this side has been really bad. So yesterday I used this probably too much because I feel now that it feels like it's bruised. So, now I've been doing ice and heat. I don't know if I injured it like doing exercising or yoga or what I did, but obviously something is pretty bad in my shoulder blade. Ironically, right before I start a massive job tomorrow, where I have to carry tiles upstairs for 600 square feet of tile. And the tiles are 3 feet long by 8 feet or by 8 inches wide. So that's going to be hell, especially with this. So I'm really trying to get this to work out. Now, I'm going to kind of explain everything I can when it comes to shoulder tension. To give you kind of an idea, say your posture is not good, right? And you're a slouch forward kind of person. It puts strain on these muscles, especially because then these muscles start to shrink in your chest. And then when you try to start to correct your posture, it hurts because these muscles are not used to it. So it's very important to have a good posture, and there are ways to change that. My posture has been awful my whole life, and every time I try to correct it when I was a bit younger, I would try to do this and then I'd be like, no, this hurts too much. I can't do it. I don't have the muscle and the strength to do that, and I had to stop. And so finally I started seeing a chiropractor, and there's this band. I borrowed it to my friend because now I don't need it anymore because I've finally corrected my posture. But it's a band that looks like the infinity sign. And basically what you do is you put it around your back and over your arms, and it loops here and crisscrosses on the back of your back. What it does is help to pull your shoulders back. And so when you start to wear this thing, it can get a little uncomfortable in your pit area sometimes. So play with it. Either wear it under your clothes, over your clothes, see what feels best for you. The other thing is you don't have to wear it very long. He recommended that you just start by wearing it for like 15 to 20 minutes a day. It'll slowly help to correct it. You don't want to do it too fast or you're going to be in a lot of pain. I wore mine as much as I could. One of the good places to wear it is, for me at least, was in my car because I noticed that that was a place that I would slouch a lot, and I was in my car a lot. So the best place for me, it seemed, to use that was in that scenario. So if you do try that, I would just say pay attention to your posture and when it's the worst. Like whatever activity you're doing, whether it's driving, sitting, coloring, walking, whatever it is that you notice your posture is your worst, I would recommend using it then and use it for as long as you can. Sorry, I got interrupted again. But what I was saying is just wear it when you feel that your posture is at your worst, and then you can slowly start to wear it more often. Um, as long as it's comfortable for you. There is no rule on it. After all, anything that you do is going to be better than nothing. So even if you wear it for a couple minutes a day, at least you're trying, and at least you're wearing it, and you're conscious that you're trying, or that you need to try to do something to make it better. But back to the hook. I bought this so that I could get into that spot. I cannot do this side anymore because it hurts so bad right now. I think I way overdid it, and so now I'm icing and heating it to try to make it better. But this hook is so nice. You can use it in so many different ways. You can use it where you loop it kind of like underneath, and you can use it to get into those spots, and then use this hand to kind of pull and put pressure on it to get into where you want it. The best thing to do is to find that uncomfortable spot. Usually that's where the tension is being held. Hold it there. And if you feel a twitch, that means your muscle released. You won't always feel a twitch, but sometimes you will. And if you do, I would let go after that because you probably are going to overdo it. If you get that release and then continue to hold it on there, then you're going to probably cause more damage than anything. I also use this on my neck, my feet, my back, my low back. I mean, it's incredible. It helps me so much. I like using these guys on my feet, on the bottom of my feet. I also like using this one on the bottom of my feet. I like using the smaller hook when I'm doing stuff with my neck. And please, I think I had already said, but if you do this on your neck, please look up information about it because you can really damage yourself in your neck area if you do this wrong. Um, so, like, I'll take it to the base of my skull because I get a lot of pain right here and these small muscles in the base of your head. Those muscles are very tiny, so you don't want to overdo it. Otherwise, you can cause more pain. But what I like to do is I just put it there and I kind of just put some pressure and I pull it down along that spot. And if I find a spot that's extra tender, I'll hold it there for a minute and then I kind of drag it down again. The whole point is to release that spot and to pull whatever is stuck in that spot down. You want to always kind of work towards your heart, is what I gathered. I don't know for sure, but maybe that is fact. I will look it up. But essentially, what you want to do is put that pressure towards the center of your body, and then it'll kind of clear out and recirculate properly. One of the other things I like to use is my Theragun. No, I got very lucky and I did not buy this. This is a very, very expensive tool. It's actually also something that you are supposed to be certified in order to use on clients and stuff like that if you're a massage therapist or whatever. Because there's very technical things with this, and things that you cannot do with this. One of the biggest things with these Theraguns is please do not ever, 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 ever use this on your neck. What it does is it moves so fast that when you're on a spot on your neck, it can stop the blood flow because of the vibration. And if it does that and say you're on an artery, it can cause you to have a stroke. So this I like to use on my feet, my legs. There are many different attachments. I really like to use it on my hands. I have a lot of problems with my hands, and it is this one especially with this point really gets into there. I like the pointed one for my feet as well. And I sometimes will use this on my back, even though it's hard to do because I have to hold it like this. One of the big things I want to make sure to mention is that when you're using any of these things, whatever muscle you're working on, try not to have any kind of, you want it fully relaxed. So say you're using this on this shoulder, right? And you're using the other hand for pressure. Do not use the hand that you're working for the side that you're working on. You want that to be completely relaxed. So use your opposite hand to pull and use pressure. That way your muscle is not tense, because if you're trying to relieve a tense muscle, it's going to be very confused. Your muscle is being told by your body to activate, but this is telling it to relax and it's just confusing it. So that's important. That's why I say that with this too. If I use this on my shoulders, I don't use the same arm to the same shoulder. Defeats the purpose. I go like this and use it on the other side. And I try to get into that blade spot. But the other things that I do are I have a shiatsu massager as well. It's a deep tissue shoulder kneading shiatsu massager. Normally it's in bed with me, but I actually had it in the living room because I was in the living room yesterday using it, and for the sake of this video and it getting long, I'm not going to go get it. If anyone wants to see it, I'll post a video about it. I love that thing. It's amazing. You can use it anywhere. I use it on my back. I use it in these muscles sometimes. I use it on my shoulders and my lower back. I'll even use it on my thighs sometimes, my feet, my calves, my hands. It is incredible. I love it. But this is for people who like deep tissue. So, and kind of the same with this in a sense. I mean, you can apply whatever pressure you want with this, but I feel like this is more for a deep tissue thing. So yeah, that's kind of the gist of the things that I kind of wanted to talk about today. If you have any questions about any of the things that I brought up, please feel free to ask. If you also use any of these things and would like to give your input, please feel free. if you use Emgality, share your experience. If you use these hooks and you have any kind of tips or tricks, or if maybe I explained anything incorrectly or had incorrect information, please feel free to correct me. I don't like giving out incorrect information, so please feel free. Again, thank you so much if you follow me. If you are watching this video and you made it to the end, I really appreciate you for hanging in there, and I hope you all have a great day. Love you!